So to summarize in a picture, so these are the various aneurysms in the paraclinoid ICA. So this is the origin of the ophthalmic artery. So here is the optic strut, and this is the clinoid segment. So here you have the clinoid segment aneurysms, the ophthalmic artery aneurysm, the dorsal variant ophthalmic artery aneurysm, and here you have the ventral type of aneurysm, the superior hypophyseal artery aneurysm, and then the cave aneurysm. So these are all seen related medial to the ICA. So again, in the superior view, you can see the origin of the ophthalmic artery aneurysm, the dorsal variant, the superior hypophyseal artery aneurysm. So always remember the ICA. So the surface which you see here is the dorsal surface, whereas the surface you see underneath the carotid artery, that is the ventral surface. Because of the various bends and turns of the ICA, the dorsal surface appears superior, the ventral surface appears inferior. Again, with the anterior view, the various paraclinoid aneurysms. So medially, you have the cave and the superior hypophyseal artery aneurysm. And then you have the anterior, the clinoid segment aneurysm, the ophthalmic artery, and the dorsal variant. So here, with regard to the cave aneurysm, so this is the cave aneurysm. This is the proximal dural ring, and this is the distal dural ring. Okay, this is the proximal dural ring, and this is the distal dural ring. So most of the times, the cave aneurysms are asymptomatic, and it doesn't encroach beyond the distal dural ring. Sometimes these cave aneurysms can enlarge in size and can penetrate through the distal dural ring, or it can lie just within the cave, going either inferiorly or superior. So the paraclinoid aneurysm predominantly is seen among the females, the high incidence of being multiple. If the is small, less than 1 centimeter, and if it is asymptomatic, it has a very low risk of SAH, and they can be managed conservatively. And the headaches from clinoid segment is usually because of the involvement of the ipsilateral V1 segment of the trigeminal nerve. The larger clinoidal segment aneurysms, they often extend into the subarachnoid space. So once when they enter into the subarachnoid space, there is increased risk of the rupture. So the intervention should be considered even if it is asymptomatic. So up to half of patients with ophthalmic segment aneurysms, they have additional intracranial aneurysms elsewhere in the body, elsewhere in the intracranial. With the exception of the dorsal variant, most small aneurysms in the ophthalmic segment, they have a lower rupture risk than those at other intracranial locations. The treatment is indicated for virtually all symptomatic aneurysms and for those larger than 1 centimeter. So the patient presenting with visual loss should be treated urgently, ideally surgery if the patient's risk factors and the experience of the operating team is reasonable. And endovascular techniques, both deconstructive and reconstructive, have emerged as viable options for the treatment of many aneurysms. The development of endoluminal flow diverters applied to large or giant lesions have become a particularly exciting alternative to surgery for very complex paraclinoid lesions. So ultimately, this is the type of exposure to be done in paraclinoid aneurysms. So what we see here is after drilling and removing the anterior clinoid process. So after seeing orienting to this anatomy, we will get into the illustrations or the stepwise to how to achieve this exposure. So after drilling and removing the anterior clinoid process, so what we see here is this is the clinoidal segment of the ICA, and this is the ophthalmic segment of the ICA. And this is the optic nerve, and this is the optic canal which has been unroofed. So what you see here is this is the proximal dural ring, which is also called as the carotid oculomotor membrane or the lower dural ring. And this is the distal dural ring or the upper dural ring, which you see here, which lies above the anterior clinoid process. So with the ICA, which is between the proximal dural ring and the distal dural ring, is the clinoid segment of the ICA. Okay, so then here is the so this exposure, so delineating the anatomy with this exposure is very, very crucial in clipping the aneurysms at this area. So once this exposure is done, then the release of the dural rings has to be done to skeletonize the ICA and ophthalmic artery and the optic nerve, and then the aneurysm can be visualized to clip.